Now, I know a lot of you are probably like, oh my goodness, there are more than 600 muscles. How the heck am I supposed to memorize all this in time for exam too? Here's the thing. I expect you to know all the bones, and you'll find out when you're studying the muscles why I want you to know all the bones. But do I expect you to know every single muscle, every single organ insertion? No, I'm realistic about this. So here's a good place to start. Now, this isn't the only thing you should know, but I think all of these are generally superficial outer muscles, and a lot of these, especially if you like to work out in the gym and build these muscles, you probably see are familiar with a lot of these. But again, I think this is a pretty good list of where to begin. So this is a good starting image. Why? Because it has many of these muscles. It kind of shows you generally where they are in the body. And again, this is just showing the anterior, relatively superficial muscles. And over here we have the posterior. So notice that a lot of the posterior muscles, they're pretty big and broad. And what we have here, so you have slightly less in this figure compared to the anterior. And here's the OpenStax version. And again, it's very similar and overlapping, and you can see the difference between OpenStax and a Martini. Again, that's why I made some of these Martini figures up. If you again go to the resources folder in La Lima and check there for the Martini figures, because I mean, not OpenStax is pretty good, but you can definitely see a difference between the level of detail, and especially when it comes to the leg muscles, it's kind of washed out in this picture. Of course, it is a drawing too. And here's the posterior. So this is a good place to just start. If you're starting from zero, and again, this is a good place to try to identify and name all of these muscles. So something you can do is like, if you're good with digital things, you can cover up all of these names and kind of test yourself. Okay, where is this line pointing to? Where is this line pointing to? Or you can print it out. You can print it out and then cover it up using whiteout, post-it notes, washi tape, whatever your favorite stationery is, and kind of like, okay, do I know this? And kind of revealing it. And if you have extra time, I don't know if it would be, I don't know, it would take up a lot of time. Flashcards can take up a lot of time if you're doing it, but there could be other flashcards out there. The only thing I want to warn you about using flashcards created by someone else, especially if it's a site that doesn't have like peer review or you can flag something as incorrect. Yeah, you have to be watch out for that because what if someone created a flashcard set that has incorrect information, you could be studying the incorrect information and you don't want to be studying that. So start with these general figures. And so what I consider is that all of these muscles listed here. Now these won't be the only pictures you see on the exam because why? Again, there are better pictures that are more close up. So what I'm saying is like, okay, it should be able to name and identify these muscles. So if I point to a muscle, can you tell me what it is? Or if I name a muscle, can you tell me where it is? It has to be both ways. And why? Because like say you're in a clinic and you say someone has an injury to their triceps brachii. Well, so one you have to know what the name of that muscle is. And if someone's reading the report, if they don't know where the triceps brachii is, how the heck are they going to know where to treat the patient? So you need to go both ways. Not only need to be able to name a muscle that's pointed out, but also be able to locate a muscle. So again, you need both pieces of information to actually have an understanding. So I say including pictures showing regions up close. I'll explain why real soon. So I'm not trying to give you more work, but I'm going to explain why you shouldn't just study these images. You should also see these muscles in other images that are on OpenStax and on the Martini slides. So I'm going to make at least 50% of these anatomy questions on these listed muscles. Again, anything that's listed here in these images, I'll think about half of the muscle anatomy questions will be on those muscles. But will not necessarily be these four images. And I'll show you close-ups of these images later on. And look at the Martini slides. Again, there's a reason why I made them uploaded. Because again, I mean, if you've looked at if you have the Martini book and look at the OpenStax version, OpenStax version has fewer labeled muscles, and you notice a general difference in quality of how definition of the muscles and telling them apart. The remaining muscles, I will release a study guide this weekend, so they'll be listed on there. But yes, including regions showing up close. So what do I mean by that? So here is the pectoralis major, right? So here is in those previous 4 pictures, it's showing it like this. And here's muscles of the abdomen. So you should be able to identify the pec major in images like this. I mean, it's pretty obvious. It's relatively superior to the abdomen, and it's a big, large thoracic muscle. And you should be able to identify it in this picture as well. So this is what I mean, like, not only identify it in that overall picture of the human body, but also up close regional. So you should be able to identify the pec major in this picture as well. So that's what I'm kind of getting at with, like, not only be able to identify it in a big picture or a zoomed out picture, but also in a regional picture that's only showing a certain section of the body. Now here we have the biceps femoris. And what do you see here is that the biceps femoris is this muscle running here. But here it is in the open stacks figure. Again, it's good to know that so sometimes, like, I mean, you shouldn't study anatomy just from one picture. That's what I'm getting at here. Because you notice that, yeah, it's different pictures, but what do you notice? Well, the biceps femoris is more lateral. It's not toward the medial side of the leg. And that's what we see here. Compared to all the other, like, hamstrings right here, you see that the biceps femoris is more lateral. And here we have a picture of the leg itself. And here we have the biceps femoris. Again, we have the long and short head right here. And again, this is what I'm getting at. So notice that in all 3 pictures, the biceps femoris is look at the overall arrangement compared to the rest of the muscles. 1 is posterior, 2 is more lateral. So that's what I'm trying to get you at. You're trying to get just like know general arrangements of these muscles. But why do I want you to know these regional pictures? Well, if I show you the biceps femoris and I point it out on a picture, would you rather me point it out on this picture I'm showing right here, or this tiny part on this picture right here? Again, if we have it in this zoomed in region, it's much more zoomed in. You have a bigger target, better idea of where this muscle is. So this is why if I'm trying to focus on an image or muscle that's kind of hard to see in this like zoomed out area right here, like what if I pointed to these muscles? Would you rather see a close-up of the posterior shoulder, or would you rather me try to label it in this tiny region right here? So this is why you need to not only know those overall body pictures, but you also need to know those zoomed in regional pictures as well. Again, this is a good place to start. I will tell you in the later lectures of other muscles that I would like you to know and that aren't on the list, but again, this is a good place to start. And again, if you're taking the lab, your TA might focus, like your TAs have different backgrounds and interests, and sometimes they might focus on one more muscle group than the other. Like some of your TAs are more interested in like kinesiology or have done a lot of anatomy, so they might go more in detail with some of these. So yeah, those 4 images are fair game. I can test you on it, but again, don't get confused and think that those are the only muscles I will test you on. 50% of the muscle anatomy will come from that fair game list.